Doctors and nurses of Reddit. What self-diagnosis of a patient surprisingly turned out to be right? A man came in, saying he had an aggressive cancer on his back. He also told us that he'd run no tests. So we were skeptic tbh. When we ran the test, though, we saw he was right. Seriously. I had an obsessed tooth that the infection had become so severe that I lost vision in my right eye. Went to the and they told me it was pink eye. I tried explaining that over a couple days I literally felt the infection move from my tooth, through my nose and into my eye. They said that doesn't happen and sent me home with eye drops. 3 days later I had a face that was swollen twice the size it should have been. They removed the tooth and put me on antibiotics. Not nurse, but my mother worked at a children's hospital. In X-ray, her second born, not me, was vomiting and having symptoms as soon as he was born. She believed it was pyloric stenosis, a fairly rare case where the sphincter in the stomach closes up, preventing eating. The first doctor dismissed my mother, thinking she was being normal mother paranoid. My annoyed mother brought her to a second doctor. The second doctor called in his med students and said, "This is a baby with very, very early onset pyloric stenosis. You will not see it often this early." The mother just recognized it. My sister had a lump behind her ear that was causing her pain and was growing. My mom used to be a nurse, and she thought it didn't look right. It wasn't just a cyst, so she kept monitoring it and started to become worried that it might be cancerous. For a whole year my mom went back and forth with doctors asking them to take her seriously, and one doctor finally agreed to go in and biopsy it. Lo and behold, my sister had stage 1 cancer, and it was a rare form at that. My mom is a nurse supervisor at a nursing home. Multiple times, patients have walked up to her and said goodbye, that they're going to die that night. Even though these residents have been perfectly mobile and with it they have always been right. Not to doc or nurse but a patient. I was having a kidney stone and my BF at the time took me to the ER. The nurse kept asking me what I did to myself, because I was practically squirming in pain. Through tears I managed to get out, "It's a kidney stone." I then sat in the waiting room practically passing out until my BF somewhat yelled at the staff. They came over to get me and I couldn't even walk. The nurse said, "Well, are you coming back?" My BF said, "Get her a fucking wheelchair." 6 hours and a round of morphine later I passed the stone. The nurse said, "Oh, look at that, it was a kidney stone." Like seriously, WT. I've told this story before. I had a 65-year-old female patient with a history of well-controlled hypertension and diabetes. Otherwise healthy. She woke up in the morning and told her daughter that she would die that day. She had breakfast. She demanded that the daughter take her to a lawyer to make a living will in order to make sure that she would be DNR when she died. The daughter humored her. She then had lunch at a restaurant. At 4 p.m. she collapsed. She came to the where I saw her. The daughter presented the living will to me. She died at SPM comfortably. I had a spontaneous pneumothorax, collapsed lung, that came out of nowhere when I was 17. Had to go to the hospital and get a tube hooked up to my thoracic cavity to reinflate my lung. A week later I was in statistics class and I felt my other lung collapse. I immediately knew what it was. Kind of a weird but very distinct feeling of pain and shortness of breath. Cut to me in the school nurse's office trying to explain that I had a spontaneous pneumothorax and I need to go to the hospital. Yeah, she didn't believe me at first. Edit. Damn it, my first plat is for being tall and skinny. Not a doc or a nurse, but back in the early 80s my Mern, 30 at the time, could not convince several docs that she had breast cancer. It was different to just a lump or pain. They all responded with, "You're too young." Finally, got one doc to write a referral to a specialist so she would shut up about it. She had breast cancer. Was told she may need a mastectomy, but after going in they were able to remove enough without having to go that far. She went back to the original doc and had a go at him and said if she ever heard his name come up for malpractice in the future she would make a statement against him. She was in medical industry. Told him to never tell a woman she was too young for breast cancer. Edit. I called my mom for more details. It was in the right breast. There was no lump, just a dull and fairly constant pain, but not an intense pain. The mass was removed. However, years later she had same pain and had another mass removed. Years later again and had small lumps, rice grain size, show up on mammogram and removed. No pain with these. This seems to reoccur on average every 10 years. She also told the doctor he was a danger to women and should retire. Yes, we have good health care. Live in Australia. Both of us get annual mammograms. I am not between ages 50 to 75. HOR related to a doctor. So it isn't fully subsidized. I go to a private hospital that does the ultrasound as well. My breasts don't mammogram very well. Bill about $500. But based on family history I will keep going. Not the doctor, but I went in because I had shingles. Told them up front I thought it was shingles. The doctor kind of chuckles and she says, "Well, you are far too young to have shingles. It's impossible." So I lifted my shirt and showed her my side where it was, and I instantly saw her eyes widen as she goes, "My, that is definitely shingles." The doctor and nurses were a little sheepish and apologetic, but they did a great job helping me get better. I was the youngest case they'd ever seen. Early 20s at the time. I read about a woman who had a voice in her head that kept telling her that she had a brain tumor. She eventually got tested and it turned out that she did have a tumor and it was causing the auditory hallucinations. My mom went to the doctor's complaint about a pain in her lower back by her kidney. The doctor did a quick checkup and told her it was nothing, that she was probably just sleeping wrong. My mom mentioned cancer and the doctor said that it wasn't very likely because people with kidney cancer don't usually feel anything. She was adamant that something was wrong, so she went to another doctor that told her the same thing but said he would run some tests to show her that it wasn't cancer. When the results came back from the test, it turned out she did in fact have cancer on one of her kidneys, and because she caught at such an early stage, they were able to remove it before it spread. I am neither of those. But when this question came up a few months back, I remember someone saying that a man came in because when he peed outside his pee attracted bees. Therefore he thought he was diabetic because sugar attracts bees. So he got some tests done and turns out he was right. Patient in a care home was complaining of eye pain and facial tightness. She told me it was shingles. I reported it to the physician and supported that it did look like shingles. Doctor did not believe me or the patient. Poor lady suffered for several days until the night staff sent to the hospital. Guess what? Ocular shingles. Long time ago, a patient of mine in the mental health unit had a delusion that he had a bleed in his brain. Kept on it for a month. One night he actually did have a massive spontaneous intracerebral bleed. Poor guy died. After that,